Hey, okay, we're back. Yay, we're getting through this. I think module 3 is a lot of the meat of understanding all the potential health implications. So we're just about almost halfway through module 3. So let's just get going here. And I want to remind you my disclaimer disclosure. I know it's getting old. I have to do it every time. But remember, this is not medical advice. This is educational, informational material for you to then be able to go to your own provider and get that medical advice. I'm just here to inform you so you have that information. Okay. And again, I'm not getting paid by any drug or drug company, laboratory, or imaging company for this, for mentioning any medications or testing or anything like that. So let's first start out by talking about thyroid disorders because they are very common. A lot of women have been at least tested for thyroid disorders because they're a lot more common as we get older. Particularly more risk if you have a family history, of course, but even without a family history. And the problem is that the same symptoms that you experience in perimenopause are the same symptoms that you might experience with either hypo or hyperthyroidism. So that's why it's important to get that ruled out. Autoimmune thyroiditis, which would be something like a Hashimoto's, if you've heard of that, would peak around this age as well. So the testing that you would want to have done, usually the most doctors are just going to do a TSH, which is the thyroid stimulating hormone that your pituitary gland releases to stimulate your thyroid gland. Okay. But this may not give you the full picture because sometimes you can have a normal thyroid level, but your free T4 or free T3, which are the two thyroid hormones to check, those may be abnormal. So it's important that if you do need to get that checked, if the doctor is recommending to get checked for thyroid disease or nurse practitioner, or whoever it is you're seeing, or if you're concerned about it and you want to get tested, then you want to make sure that you're getting not just the TSH, which often is ordered with a reflex T4. And I often just do it that way if I'm really not suspecting. But if I really have a strong suspicion, I'll get the free T4 and free T3. So I would recommend getting those tests done if you're having that ruled out. Oh, metabolic syndrome. What is metabolic syndrome? It's the combination of insulin resistance with blood pressure going up, abnormal cholesterol profile, and an increase in your weight or the circumference of your waist. So your weight is depositing in your tummy area. And really, metabolic syndrome is the precursor to diabetes. So you could almost say it's a pre-diabetes condition, but it's not isolated to just your blood sugars. At the same time, usually there's obesity and abnormal lipid panel or cholesterol, and high blood pressure develops as well. So there's a higher risk for this condition developing in perimenopause because of the lowered insulin sensitivity, right? Increased insulin resistance just from decreasing estrogen levels. And as we talked about at one of the other videos, you're also losing muscle mass, and that increases your risk for insulin resistance. And as you have more insulin resistance, you gain weight in the midsection. And also with more insulin resistance, you develop diabetes because your pancreas can't keep producing that much, more and more insulin to get your body to use the same amount of glucose. What that does is it also increases your cardiovascular risk because then the blood vessels there's getting deposits of plaque and also constricting more from diabetes. All right, sorry, I paused for a second for a sneeze. And I didn't mention something here. And again, the hormone shifts we talked about that cause you to gain weight in the midsection. So pre-diabetes and diabetes as you lose the estrogen and you have more insulin resistance, that increases your rate of prediabetes and type 2 diabetes after menopause. So really important that even if you're not going on estrogen, you are doing resistance training, which helps with your insulin resistance. And quite often you have to keep also doing some walking or cardio, and you have to actually change maybe how you eat. You may not be able to eat as much as you used to. You may not be able to eat all the sugary, carby things that you wanted to or used to before. You have to be thinking more about the choices that you're making in your diet. Once you gain weight, it's hard to lose the weight. So and in order to lose weight in your tummy area, it really takes lowering the carb content in your diet. So bread should not be a frequent thing that you're consuming. And if you're going to have some other carbs, you want to have whole grains. If potatoes are still okay, sweet potatoes are better, but these are whole grains. They're not processed. Brown rice over white rice, because brown rice has more fiber. And so then by having more fiber, you don't get as much of a burst in your insulin levels. So it's better for your insulin resistance. Quinoa is good. Whole grain pastas. No one's paying me to say, but I love Banza pasta, Banza. It's made from chickpea flour. So it's also gluten-free if anyone has gluten issues, but it also has higher protein content. So there are definitely alternatives there to help get some of that tummy fat under control. Another problem that can be more likely to develop as you approach menopause is gallstones. Although, while there are statistics showing that there's a higher risk of gallstones in menopause, really the biggest risk is more perimenopause, actually, because as the estrogen increases, the estrogen you have that hormone imbalance between estrogen, estrogen is staying high, and you have the lower progesterone. There's more of a cholesterol saturation in the bile, and we have cholesterol overly saturated, like the concentration's too high, then you can develop more stones. So estrogen actually contributes to perimenopause rather than menopause is when the gallstones actually start to develop. And we used to have something, it's going to sound horrible to you, but I'm just going to throw it out there because when I was in medical school many years ago, we didn't say things delicately, politically correctly, or anything like that. So we used to say for gallstones, the risks are female, fat, 40, and fertile. So female, fat, 40, fertile. So 40 years old is kind of when perimenopause might be starting, but you're still fertile. That estrogen level still up there, but it's as the progesterone level is dropping, that concentration in the bile. So watch out for that. And what are some things you can do to help prevent gallbladder disease? Is really not eating really high fat foods, which is probably better for you. So yeah, prevention overall. We talked a little bit about this, but again, lifestyle, your diet, eat foods that are not ultra processed, so minimally processed food or not processed. So it means real food that you have to cook, the things you get out of the fridge, like fruits and vegetables and yogurt and milk, cheese, cooking cooked vegetables, make whole grains like rice or whole grain pastas or potatoes, not fried, bake because it's less fat. So this is just general guidelines. You may decide you want to meet with a dietitian. Your doctor can refer you to sit down with a dietitian, especially if you have any lab abnormalities. So if you come up with an elevated cholesterol or you have prediabetes, a lot of times your insurance will cover for you to sit down with a registered dietitian to go over what you're actually eating and how you can modify that. Obviously, exercise is important. It's important for your heart health long term, but it's important for keeping your weight down and strengthening your bones, strengthening your muscles. And when you have more muscles, you have less insulin resistance, so less likelihood to develop diabetes. So there's so many benefits for exercise. And we're learning more that you do need to do those weight exercises, what we call resistance training. But it's also good to do the cardio, which practices is good for your heart. So you want to have a balance and do multiple different things. I know it's hard. How are you supposed to incorporate all this? You can do it. You just have to do one thing at a time. So if you're not doing any exercise at all, start with either one or the other. Start with either, those walks, or start with some weights. Um, but with walking, if you're not doing a lot of walking yet, start with 10-minute walks. Maybe instead of trying to get a big walk in, do 10 minutes after each meal. I find that is most helpful for lowering your insulin and blood sugars. So 10 minutes after each meal. Um, and then weight management. Weight management isn't necessarily all in your hands. It can be hard if you've gained a lot of weight over the years or even in a short amount of time. If you are overweight or obese, there are now doctors that specialize in weight loss. A lot of primary care doctors can treat you as well. And there are a lot of medication options out there to help you. Does it mean you have to go on a medication? No. Like, not everyone needs medication to help them make the changes that are going to impact their health and help them get their weight down. But some people, it's hard for them. Sometimes you need something extra to help you have less of an appetite. And so that's where medications can come in. So I definitely recommend trying to find maybe a bariatric specialist, someone who specializes in weight loss, particularly weight loss medications. And there's even sometimes some companies now that can do those treatments online, but better to go see someone in person who's going to have you come in regularly so that you have some of that accountability. Okay, screening. We talked about the thyroid testing. Metabolic labs are, we want to check your lipid panel, which is cholesterol, and it breaks it down into the good and the bad cholesterol. And usually, once in your life, some doctors recommend having a lipoprotein A test done just to make sure there's not something running in the family if your cholesterol is elevated. And also, there are some doctors who will also check something else called an ApoB, which can help them with treatment. So the first test is starting out with that lipid panel. And if it's normal, great. If it's not normal, then there may be additional tests that you want to get done that will help your provider in treating you. And the glucose monitoring, I first recommend getting a hemoglobin A1C, which is the test that's going to tell us how your body has been managing blood glucose over the 3 months prior. Some doctors will also check a fasting insulin, sometimes a non-fasting insulin. So fasting insulin is going to be where you are sitting right now if you haven't eaten anything for 12 hours. That may or may not be useful. It might be more useful to know what is your body doing in response to food. So getting an insulin level after you eat might give a better idea of if you're having insulin resistance, because if your insulin level an hour or 2 hours after you eat is very high, that is saying that your body's having to release more insulin for a certain amount of food than someone else might not be releasing. It's not normal. So these are more specialized tests that may help in managing and diagnosing metabolic syndrome or even prediabetes early. And medical therapy. So if you have thyroid disorder, in addition to, you came in with hot flashes and turns out you have a thyroid disorder, potentially just treating that thyroid disorder is going to take care of the hot flashes. So a lot of symptoms could resolve with treatment of thyroid disorder. Weight gain could resolve. Hair thinning could resolve. So there's a lot of symptoms that could resolve with treatment of thyroid disorder. And then diabetes, once the insulin resistance is under control, if you have diabetes, if you get insulin resistance under control, it will be easier to get that tummy weight off, and or even just keep it off. And of course, treating diabetes helps to prevent heart disease, cardiovascular disease. So does treating dyslipidemia. Treating elevated cholesterol helps to prevent cardiovascular disease like strokes and heart attacks, or even kidney disease. But also getting your cholesterol under control can also even potentially help prevent dementia. So there's some thinking that even some dementia is related to blood vessels getting clogged in the brain. So this is important. And then gallstones, there are some medications that people can take for gallstones. Usually would say you have to watch what you're eating, not eat any high fat foods or meals. But often gallstones end up necessitating surgery. So, all right, we talked about a lot of stuff here. Thyroid disorders, peaking in midlife, so being alert about that. Being aware also of metabolic syndrome and diabetes risk, which is higher once you hit menopause or after menopause in postmenopause. Gallstones are linked to estrogen's effect on the bile cholesterol, so more of an issue during perimenopause. And then just preventing. That's what we need to do. So as soon as you start thinking like, oh, am I gaining weight in the midline, or maybe you start thinking before I even gain any weight, I'm going to start exercising and eat healthier and make those smart choices so that you can live not just a long life, but a long, healthy life, right? No one wants to live a long life but be unhealthy, because that won't be any fun. All right, I'll see you guys next time.